Hi, I'm Brittany Blockman. I'm a pediatric integrative medicine physician and the founder and director of Communitas, whose mission is to transform the experience of pediatric chronic illness into an opportunity for health enhancement, for connection, and for exploration of what really matters for the whole family. With this in mind, Communitas created a retreat program that allows young people living with chronic illness and their caregivers to immerse themselves in community for 5 days in a natural setting and learn transformative, healthy living practices together. I've had a few formative experiences that led me to this point. One was my experience with my mother's cancer and her death when I was in high school. Through my mother's illness, I found that illness had the potential to be an opportunity to help us reprioritize our lives, to make meaning, and to connect with others. Another was working at St. Jude Children's Hospital as a young teen. I heard the same stories of loneliness from the families with whom I worked over and over again. And I kept thinking, what if we could somehow tear down these hospital walls and connect everyone so that they know they're not alone? What if we could create a completely new healing environment that repositions this time of illness from the worst of times to a better time, a time of rich connection, self empowerment, and experiences about healthy living for the whole family? Through this experience and my experience with my mother, and then my later experience of being a physician, I began to have a vision of it creating a new healing model, one that would bring families together in a communal healing space and create opportunities for them to harness the interruption of illness to bring about positive changes and connection. These visions I had as a young person are the inspiration for Communitas and how I view what we're doing. We're tearing down the dividing walls of medicine and connecting people who are typically isolated in their illnesses. We're bringing empowering healing practices out of the hospital and the clinic and into the community and into people's lives. And we're saying that community is also medicine.